Hello everyone, in behalf of all my partners, I'm going to be the one who's explaining to you each slide of this presentation, which is called Healthcare System in Mexico. The question we're trying to answer here is how is that this system works and what are its principal strengths. First of all, we need to understand the health problems that Mexico is facing at the time. In the last century, around 50% of the death was because of a common infection, like reproductive problem and nutritional diseases. Nowadays, this percentage decreased to 15%, but the transmissible diseases increased around 75% and 11% of the death. One of the problems that Mexico has had always to face is obesity, which has led the country to a bunch of weight-related problems, like diabetes, which is the first cause of death in Mexico, followed by heart-related problems. How much is health spending? Total health expenditure as a percentage of GDP increased from 5.1% in 2000 to 5.9%. The public spending on health accounted for 46.7% of total health expenditure. The public expenditure on health amounted to 330,339 million pesos. Most of the expenditure corresponds to Secretaría de Salud, followed by IMSS and ISSSTE. And then, who pays? The health services provided by Social Security institutions to their members are financed by the contributions of the employer, the contributions of the worker, and the contributions of the government. The IMSS-O is financed with resources from the federal government, but is operated by the IMSS. The SPS is funded through contributions from the federal government, state government, and individuals. And who's the head of health? The federal government oversees planning all the strategies of the sector as well as the priorities and the intra and intersectoral coordination, although regulates the healthcare, which is developed with other corporations. The COFEPRIS oversees protecting the society from events that can damage those who have been exposed to biological, chemical, physical factors. The General Directorate of Performance Evaluation of the Secretaría de Salud is in charge to evaluate the development of the national and local health systems as well as the personal and public services. The results are published in Rendición de Cuentas. And how is the health system structured in Mexico? We have three sectors: the public sector, which is composed by a variety of public institutions, the private sector, which is composed by insurance companies, private clinics, and hospitals, and the Seguro Popular program, which was set up to help cover more of the uninsured population, and it's free. What is the infrastructure and resources that health services have? In Mexico, there are 23,858 health units, 1,182 public hospitals, and 3,172 private hospitals, a total of 76,643 beds in hospitals, and 171,000 doctors and 223,000 nurses. The beneficiaries of health institutions are salaried workers, retirees and their families, self-employed, and population with capacity to pay. And the principal benefit is the covering of the most health problems that Mexico presents nowadays. In general, Mexico has a standard good healthcare system. The common complaint among users of public services is related to the long waiting periods for elective surgeries. Thank you.